Okay, I think we can kick off. So good morning, everyone. My name is Alan Barrett, Director of the ESRI, and of course, we're getting more and more used to these types of arrangements to disseminate ESRI work. So it's a pleasure for me to welcome everybody to today's launch. So the study we're talking about today is titled Social Transfers and Deprivation in Ireland, a study of cash and non-cash payments tied to housing, childcare and primary healthcare services. So it's a particular pleasure for me to welcome Minister Joe O'Brien, Minister O'Brien, Minister of State for Community Development and Charities. And the Minister will say a couple of words in a few moments. It's always nice for me on these occasions to acknowledge the funding provided to the Institute to undertake this work, in this case by the Department of Employment Affairs and Social Protection. I always thank departments, but I think it's particularly the case when we are doing a joint launch with the DEASP that I do like to sort of mention the fact, of course, that the department have been funding this type of work in the Institute for many, many years. And that again, a lot of you on this call will be familiar with the huge body of research that has developed over the years, undertaken by the ESRI, but funded by the department in the old days, of course, through the Combat Poverty Agency, and more recently through the department itself. So always like to acknowledge the funding provided for this study, but more generally to recognise the money that was provided over the years and the great engagement whereby, you know, just that huge volume of work built up over time. I also want to congratulate, of course, the authors of today's report. So in a couple of minutes, you'll be hearing from Bertrand Maitre, who will take you through the details of the study, but also Privalko and Dorothy Watson worked on the study as well. So again, congratulations to them for such an excellent piece of work. So with that, I will now hand over to Minister O'Brien. And again, it's a great pleasure to welcome you, Minister, and we look forward to hearing your opening remarks.
Thank you, Alan, and good morning all. The Programme for Government commits to, and I quote, rigorous implementation of the new social inclusion strategy, a roadmap for social inclusion 2020 to 2025. There are 69 commitments in that roadmap, but I'll perhaps pull out the one that's most relevant to today, in my view at least, which is the commitment to reduce consistent poverty to 2% or lower by 2025. This poverty target, I think, is key for a number of reasons, primarily due to the hugely damaging impact that poverty has on people's lives, their life prospects and society in general. But the consistent poverty target is key for today's launch, as its calculation is made up of the two key components, the at-risk of poverty and social exclusion rate and the deprivation rate, which we will talk about today. I'm very happy to be here to launch this report, and I would like to thank Bertrand Maitre, Privalko and Dorothy Watson and all the ESRI team for their thorough and very detailed work in this report. I think the report is a very valuable contribution to our understanding of the interaction between certain types of cash and non-cash transfers from the state and its impact on deprivation. It is telling us that these supports that are being accessed by those who need them most, and that these transfers do help to reduce deprivation. So for me, the message is clear. We do have deprivation in Ireland and supporting the most vulnerable within our society. Now, as the analysis is based on 2017 data, it doesn't take into account the full impact of the Housing Assistance Payment, HAP, or the National Child Care Scheme, both of which have been rolled out in recent years and are valuable supports for individuals and families. It is expected that the impact of these schemes will become visible from the data from next year onwards, contributing and their contribution to the reduction in deprivation rates in Ireland. Important point from the research that kind of stood out to me was that 70% of households are in receipt of one of the transfers included in the study, with almost 25% in receipt of two or more. To me, this shows the extent of these supports across our society, and I believe it also shows a level of social solidarity that is out there and an interest in the public psyche to tackle poverty and deprivation in its various manifestations. As politicians and ministers, we are constantly looking for the most effective way of tackling challenging issues, and reducing poverty and deprivation is a challenge, and we need to know what works. Not only that, we need to know what works for different people, different families, different households. There is no one-size-fits-all approach, and this report helps us to direct our efforts. Now, the 2019 poverty data recently published by the CSO show that there has been a welcome decrease in the at-risk of poverty rate, the income poverty indicator, from 14% in 2018, 12.8 in 2019. However, the deprivation rate did actually increase to 17.8% in 2019. This is worrying, but also I think telling in terms of public policy. This comes on the back of quite a thriving economy, but it's clear then that a thriving economy alone will not lead to effective tackling of deprivation. We need research like this, but we also need the right and brave decisions at a political level if we are, frankly, to not continue the cycle of unmet poverty reduction targets. The recent data show that poverty rates for certain groups were higher than the national rates, for example, for people in vulnerable social risk groups such as lone parents and people with a disability. This makes it vital for us to know that the supports we put in place are reaching the people who need them most and are having a positive impact. Now, I was recently assigned responsibility as Minister for State for Social Inclusion Policy and the implementation of the Roadmap for Social Inclusion in the Department of Social Protection. Just last Wednesday, I chaired the first meeting of the Social Inclusion Roadmap Steering Group, which will monitor the implementation and progress of the Roadmap commitments. The steering group is comprised of members from all relevant government departments, and there was full attendance at the meeting last week, as well as 3 external members from the community voluntary sector. And I'm looking forward to working with the group to ensure the ambition of the roadmap is delivered. And there is no doubt that the roadmap targets are ambitious. And since the roadmap was published in January of this year, our world, of course, has changed dramatically due to COVID-19, and with the resultant shock to our society and economy arising from the necessary public health restrictions put in place. This has impacted all of our lives. Government has intervened with very, very significant cash transfers of the pandemic unemployment payment, the July job stimulus and the temporary wage subsidy scheme. However, pre-COVID policy strategies, social policy strategies like the Roadmap for Social Inclusion remain of central importance. They must continue to inform the key decisions required to address the challenges we are currently facing, such as with recent budgetary decisions. Budget 2021 included increases to the qualified child rates for children under and over 12 years of age, a measure which I felt was particularly important and welcome. Other important changes were increases to certain income disregards for families in receipt of the working family payment and the removal of the earnings threshold from the one-parent family payment. These changes will primarily benefit families on low incomes, one of the main target groups in the roadmap. Now, this ESRI research paper provides evidence and insight that's necessary to evaluate our strategies and to understand whether policy objectives are being achieved. While the data relates to 2017, its findings are relevant and of interest as we deal with the impact of COVID on our society and on employment in 2020. These challenges are in addition to those that existed in this country pre-COVID. And as I said, and I'll say it again, we must retain focus on these challenges by continuing to work on tackling deprivation and poverty levels. I suppose this paper marks the end of the most recent research contract between the ESRI and the Department of Social Protection, but not the end of the working relationship. I am glad to say there will be a new research programme with the ESRI. The new research programme will include additional data sets and evidence bases to complement the data from the survey on income and living conditions with research topics informed by the requirements of the Roadmap for Social Inclusion and the Programme for Government. I'm particularly interested in talking to the ESRI about mapping a theoretical route at least to the target of the 2% consistent poverty rate. Thank you again. To wrap up, thank you again to the ESRI. I suppose this report reaffirms the fact that we do have the tools at our disposal to impact deprivation, and it certainly helps us as well to point our interventions towards those who need most assistance. Thank you.
Great, thanks so much for that, Minister, and even thanks for the anyway the hint that you might be talking to us again anyway on a range of topics. And I have to say, actually, it's interesting to hear you talking about the social inclusion steering group that you're heading. We'll be interested to learn more about that, and hopefully at an event, not in the near future. We'll discuss it at greater length and maybe have some of your colleagues from the committee along anyway to fill out some of the discussion. But again, thanks so much. Now, I know you're going to stay for some of the presentation, but I know you may also have to scoot off at some stage. So if we're not talking again, just sincere thanks for the presentation today, and we'll look forward to talk to you again in the near future. Okay. So with that, I'm going to ask Bertrand to join us, and I presume you'll be sharing a screen, Bertrand, and taking us to the presentation. So while Bertrand is getting ready, can I just say, I think the plan is to talk maybe for about 25-30 minutes. We'll have a bit of time for Q&A at the end, and I know you're all very familiar with the route now. Just we'll use the Q&A function at the bottom of your screen to provide the questions, and I'll do my best then to act as moderator. So with that, over to you, Bertrand.
Okay, thanks very much, Alan. Can you see my slides on the screen?
Yes, can indeed.
Yeah, okay, that's perfect. Okay, well, thank you very much, Alan, and thank you very much, Minister, for this very nice introduction. So, as the Minister has mentioned, I'm going to talk this morning about the relationship between social transfers, cash and non-cash payments, and the relationship, with deprivation, and how, some specific transfers like housing and childcare and health services, can contribute to reduce the level of deprivation. Before starting, so I just want to thank again, as well, the Department of Employment Affairs and Social Protections for funding, this project. I want to thank as well the Central Statistic Office for supplying the data, the SILK data, on which the analysis in this report is being based. And I want to thank as well, my colleague, Mark Regan, who provided, tremendous help and assistance, in running the switch model on which some of the work is being based on. And I'm presenting, on behalf of my two colleagues, Ivan Privalko and Dorothy Watson, present here today with us. So just to give you first a little bit of background, and as the Minister has mentioned that as well, social transfers are very significant and very important components of social policies, and for many reasons. The first one is that social transfers, are supporting household income, and by doing that, they help households to prevent them, from falling into and experiencing income poverty. And as well, social transfers, and in combination with the tax system, contribute as well, to reduce income inequality. A second, purpose as well of social transfers is that, that house, the needs, in the household is changing. They are just, those incomes, as needs are changing, and as well as life cycle circumstances as well are changing. For example, that when a household, is having a child, so, the state, can provide, some support through the help and the remits of child benefits. And again, as people again are moving, from being active in the labor market to maybe retirement age, again, the state, is supporting those people, through the pension systems. But as well, and we had the experience of that this year, social transfers as well have a role to play. They are a buffer as well to the consequences of economic shocks. And we saw that, this year, like with the PUB, as the level of unemployment, rose, that, the social transfer were there, just to prevent people to fall into income poverty. Focus on as well on other kind of transfers like benefits in kind, we found that as well that tied social transfers very often are targeted vulnerable groups, and particularly in relation to people not being able to access to crucial and basic services, such as being able to access to health, to have medical care, but as well, to be able to have access to childcare facilities. And we've got, the access of those transfers, those support, that households would face a much greater risk of social exclusions. We were talking even, that maybe the health consequences that people would have if they wouldn't be able to get, medical care. When we look at, the poverty research, there's some poverty research, looking at the relationship between social transfers and income poverty, and the effect of those transfers in reducing, income poverty. But there is very little poor or very few research, in fact, that has been done looking at the relationship between transfers and the level of material deprivation. And it's only in recent years that some colleagues have looked at this relationship, and we're going to expand from the work being done by those colleagues in this piece of work. What we're going to do, as we mentioned earlier on, we're just going to focus on three kinds of transfers: housing support and healthcare and childcare. I'm going to give more details in the next slide. So we have three research questions mainly. So the first one is, what's the level of coverage of those three forms of support across the population? And if we focus on the people who are vulnerable, most needs, are those most needs more likely to receive those transfers? And again, what's the relationship between those social transfers and material deprivations across social risk groups and social class? We're going to do that, repeat that, for every kind of transfer that we're going to be looking at, over the next few slides. So the data that we're using, as the minister has mentioned, we're using, the SILK data. This is for the year 2017 at the time. That was the most recent year that was available to us. The SILK survey is an annual survey conducted by the CSO since 2004. And it collects a very wide range of information on the household income, individuals' incomes, their living conditions. We're using as well the primary care reimbursement service, which is an annual statistic called publication done by the HSE. And in this publication, the HSE is reporting all the expenditures on health, hospital nights, medicines, GP cards, medical cards, and so on. And this is broken down. This is very detailed, and this is broken down by age and gender. So the method we're going to use to estimate values to those services by using, the SILK 2017. So we know, for example, that every household in the surveys, we know if they are in receipt of housing support. So we have this information, this is included in the survey. We know as well in the household if people have access to a medical card or GP card. So we know that for the adults, and we know as well for the children, and how many people are having those services. In terms of childcare, for people who have children as well in the household, we know that if they are using formal childcare and how many hours they're using. And we have as well, of course, the age of the children. So this is, the base of the information that we're going to use. So using the switch, the ESRI switch model, which is a model to simulate, that any changes in terms of income and what people would be entitled to. So switch model, we can be entitled to, we can assign, to people using childcare facilities, and based on the level of subsidies that they would be getting, we can give, a value the childcare usage that they're having. And we're using the PCRS just to be able again to give values to medical supports that people are getting by having a medical card or a GP visit card. So how are we going to do that? So some of the literature that I presented just earlier on in the previous slide, that we are just following the work being done by colleagues Norton and Guillaume. And what they did, they look at the relationship between deprivation and social transfers by using ordinal logistic regressions, and they were able to predict different probabilities on different levels of deprivations and for different level of income. And we can do that controlling for a wide range of measures. We know if people are members, of social risk groups. We know the social class memberships. We have information as well about, the demographics of the head of household. We know the labor force status of the head of household. We know the level of education. So a very large range of information that will tell us about the relationship, between the household income and the level of deprivation that could be expected. What we're going to do is that we're going to simulate the effect of the transfers on deprivation, and we're going to look at the impact of those transfers on deprivations by looking at the change in the household income before and after the transfer. So we're going to run regressions, before the transfers. We're going to see what's the level of deprivation that people will be getting, and after we're going to put back the level of transfers that people are getting, or the values of those services, and we're going to see the change in the level of deprivation. This is quite technical, so it's very detailed in the report, but here we can't really go explain really how it's done. So we're just going to present you the overall results, and we're going to focus mostly on the basic deprivation rather than just individual levels of deprivations, like people being deprived on 1 item or 11 items. Okay. So the measure of deprivation that we're using, this is the official measure of basic deprivation used in Ireland, and simply looking at the households who are unable to afford 2 or more 11 basic goods and services. And among those, this is items on clothing, on food, on being able to heat adequately the home, to replace any worn or furniture, but again, just to interact with society as people would be entitled to, like being able to go out, meeting friends and having, presents for family members and so on. So if people are being considered as being deprived when they lack 2 or more of those 11, basic goods and services. Okay. So we are interested to see, that which vulnerable groups are going to be in receipt of those schemes, and what's the effect of transfers in reducing deprivation for those people. So there are two different ways of looking at, vulnerable groups. One is looking at, social risk groups. And people, have differences or differ in their access to the labor market, and for many reasons. One of them is simply their personal characteristics. So people would have, maybe a disability or have some illness conditions that would prevent them, to be able to access the labor market. Another reason would be that, people would have, non-work carrying responsibilities. They would have to look after a child. They would have to look after an adult or an elderly person in the house. And again, they wouldn't be able to access the labor market. Another reason would be that, people would be at different stage of the life cycles, like, children, of course, wouldn't be able to go on the labor market, but again, as well, people who have, of retirement age. So we are able, to put people into 4 groups. So we can distinguish, lone parents and their children. We can distinguish, household where someone has a disability in the household, and again, those households with and without children. We have as well working age household going, from the age of 25 to 65, and again, that's household with and without, children. And we have older household, that's people age 65 plus. The other way to identify as well vulnerable groups is looking at social class. And here it's different from the social risk, is that people have differences in resources, which are gained from the market activities. And people are classified into some specific classes, social class, that's based on the occupation of the head of household. But here, we don't have time to present results for both social risk groups and social class. So we're just going to focus on the social risk groups. But again, in the report being published today, we have all the details across social class. Just to illustrate, when we're talking about vulnerable groups, what's the experience of deprivation across social risk in 2017? So here on the right side, we're reporting the level of material deprivation. So that's people lacking 2 or more items out of a list of 11 items. And you can see that 19% of the population in Ireland, were experiencing basic deprivation. And it was much higher, as you can see on the left side on the screen. It was above 30% for lone parents and their children, and as well, for people with disability and their children. And it was much lower for other households, and particularly much lower for people over 65. Less than 10% of people over 65 were experiencing basic deprivation. So very huge disparity in terms of the experience of material deprivation. So really, lone parents and people with disability are, vulnerable groups here. So we're going to look at, so first, the first kind of social transfers and kind of support, that we are going to have a relationship, we look at the effect of those supports on deprivation. So looking at housing, so we can distinguish two kinds of housing supports. The first one is housing supplements, and the other one housing benefits. So the first one, it's really housing transfers which are connected to a household experiencing large housing costs. And there's a few items, a few kind of supports that were available at the time in 2017, like the rent supplement, and this is the most popular of the scheme that had the most larger number of recipients at the time. So other schemes, that were available again at the time, such as the mortgage interest supplement, but were ended, at the end of 2017. Rent allowance as well, it's a scheme part of the housing supplement, but it's very small. There's only a very small number of households who are getting that scheme. And as it was mentioned as well earlier on, the housing assistance payment, was not available in SIC 2017. So we don't have any information about that. So it's going to be mostly on the rent supplement, that we're going to have information. Looking at housing benefits here, we're talking about much smaller amount of payments that have been given to household. So in here, it's really linked to some kind of a specific expenses, such as people getting a TV license, free TV license, electricity or gas allowance, but as well fuel allowance or telephone support. So here we're talking with housing benefits, very, very small amounts of money compared to housing supplements. So overall, what's the level of receipt of those schemes? So you can see here on the left side that 56% of households in Ireland in 2017 didn't receive neither of those schemes, and it's mostly housing benefits that people are in receipt. 40% of households in Ireland are in receipt of housing benefits, and very few households are in receipt of housing supplements only, or even in receipt of both. So it's really mostly housing benefits that people are getting in Ireland. And remember that here we're talking about much smaller amounts of money compared to housing supplements. So when we look at the same level of receipt, the distribution of housing transfers across social risk, you can see that focusing on people over 65 here, that over 3/4 of people over 65 are in receipt of housing transfers. And again, it's going to be mostly housing benefits rather than supplements that people are getting, because it is really linked to the age. They would have the criteria to meet those benefits. Almost half of lone parents and people with disability are in receipt again as well of housing transfers, and here it's going to be mostly housing supplements that people are going to get, and very much fewer households or over households with children are in receipt of housing transfers. So what's the mean value of those transfers, and how does it vary across social risk? So on the left side, you can see that the mean value for the lone parents is quite high. It's over 2,000 euros as an annual amount. It's half of that for adults with disability, just 1,000 euros. And it's much lower for other adults and people age 65 and over. And again, that the reason for that is, as I was just mentioning earlier on, is that for those people, so it's going to be mostly housing supplements that people are getting, while here it's going to be housing benefits that people are using. So what's the effect of the receipt of housing benefits on deprivation? How much does it reduce the level of deprivation? So as I said earlier on, so we're running a regressions without those transfers. We're looking at the level of deprivation, and we're putting the level, the amount of transfer that people are receiving for housing benefits, and we see the change that it has in deprivation. And here we're just going to report the change in percentage points on the level of basic deprivation. So as you can see that when we put that back, those transfers, we see that for lone parents and children, it reduced basic deprivation by almost 6 percentage points. It's half of that for a household where someone has a disability, 3 percentage points. It's much lower in the region of 1 percentage point for other households. and people over 65. And again, the reason is being linked to the fact that the monetary value, the value of those transfers are much higher for lone parents and children and people with disability than it is for the other groups. Now we're going to look at the social transfers which are tied to health services. Here we're looking at medical card and GP visit card. So just very briefly, I mean, medical cards give free access to medical services, GP visits, medicines and hospital care. Everything is being free. Well, GP visit cards cover only the cost of GP, but not medicines and medical services. So people have to be min tested, and there are different min tests, and rules depending if you're over 70 or less than 70. So we're going to try to give values, to people holding medical cards and GP visit cards, and we know that in the household, who's getting one of those services. How do we give values to people holding medical cards or GP visit cards? So there are different, methods, and I'm just going to cite, just two of them, and the one that we're going to use here in this report. The first one is the cost per capita. It's simply looking at the total expenditures that the state has on health, and it's being divided by the number of people making use of the services. So this is a very rough method. It just gives you an average cost, and that's it. The usage method is the method that really we would need to be able to know for each individual how much people are accessing the service, how much what's the user of the service and the associated costs. And it's very detailed, but we don't have any information of that. In France, where that I know the system quite well. So we have, for example, the system called the carte vitale, where individuals accessing to any medical services or buying medicines and so on, everything is being recorded. So we know exactly for every individuals in the country how much people are using the service and how much it's going to cost. So we don't have that here. So what we're doing, we're using the risk-related approach, which is simply like the cost per capita, but having just a rough and a very broad measure of expenditures, an average. So it's being broken down by gender and age, and as well because we know that older people would have a greater usage of medical services, and this is a method which is being used quite a lot, extensively, internationally, and as well in Ireland. And here we're just citing some of the work that has been done in Ireland by colleagues from the ESRI. So that's the method we're going to use, the risk-related approach. And in order to do that, we need to get some information about expenditures, and it needs to be quite detailed, and it needs to be broken down by age and gender. So we're using the annual statistic from the PCRS, which is being published every year by the HSC, and we're going to use that publication for 2017. So from that, we'll be able to construct an age-related weights in terms of the cost that the state would have in terms of health services, and that's we have the details in terms of hospital nights, the cost of medicines, and medical card and GP visit card, and we have that, as I said, it's being broken down by age and gender. So we're going to use that to give values, to each individuals in the SIG survey when they have visit cards on GP visit cards and depending on their age and so on. Okay. So it's quite complicated, but it's very detailed, in the report. So what's the level of receipt of those services, medical cards and visit cards? So on the right side, you can see that 60% of the population in Ireland of people aged 16 plus don't have a medical card or a GP visit card, and just over a third of the population have a medical card. If we're looking at people age over 65, over 70% of them have a medical card, and very few, in fact, don't have anything. Only 16% of them. If we're looking at on the left side on the screen, over 60% of lone parents and people living in a household where someone has a disability have access to a medical card, and much lower, only 20% for other households. But we can't reproduce here, access to GP visit cards for lone parents and people with disability, because we don't have enough cases in the sample just to report the statistics. But as you can see, the vast majority of lone parents and people living in a household, with someone has a disability, have access to medical card rather than to GP visit card. So what's the value which is being given to those services, medical card and GP visit cards? So here, as you can see, not surprisingly, the highest value is being, given to people age over 65. So the value is more or less, just over 2,000 euros. It is less, for the other groups of the population. It is, the next second highest is people living in a household where someone has disability, not surprisingly as well, just 1,000 and almost 400 euros. And it's in the region of 1,000 euros for all the other groups of the population. So this is what we would expect, that people age over 65 will have a greater value attached to the usage of medical card and GP visit cards. So what's the effect of those, having those services, on the level of deprivation? And again, as we did, previously for housing supports, what we did, we run the regressions, we vote those transfers, we see the level of deprivation, we inject those values into the household income, and we see the change that it has on the level of deprivation. So by how much does it reduce, deprivation? So we see that the largest reduction is experienced by people living in a household where someone has disability. It's almost 1 percentage points reductions, but it's quite small, and it is small as well for the other groups. Very little reduction, in fact, for people over 65. And one of the reasons would be as well that, that the level of deprivation for over 65 people is quite low anyway, in general. So overall, access to medical services reduce very little the level of deprivation. So the next kind of social transfers and support that we are interested in is the childcare supports, all the schemes which are facilitating access to childcare for families in Ireland. So in 2017, there was a very wide range of supports that were available to families. So the most common one and the most popular one was the ECCE, which was, providing 15 hours of free childcare to families with children, where the child was aged, between the age of 3 and 5, and there were a wide range of other schemes as well, depending that people could have access to, and just to have people to have their children in childcare facilities, depending on their circumstances, like if people were going back to education on training, if people were on low-paid jobs, and so on. So some of those schemes have disappeared since, and at the time, the minister, Catherine Zappone, wanted to simplify maybe all of those schemes, and the plan was to introduce, the affordable childcare schemes, and it was going to be implemented in budget, 2017. It happened. It's only in the late 2019 that, that it has been renamed and now called as the National Childcare Scheme. So it's only late 2019 that scheme, has been introduced. So how we're going to give a value to the access of some of those schemes, childcare facilities, and that have been offered to families in Ireland. So again, we know that, today, and even at the time, so people are entitled to get, 15 hours of free childcare when the child is aged, between 3 and 5. We know in the household, in the city, people are reporting that the child, has access to formal childcare. So we know the value that the state is paying, to the childcare providers for the ECCE schemes. So what we're going to do, because it was supposed to be implemented in budget 2017, the affordable childcare scheme, we know what the level of subsidies would have been if it had been implemented at the time. We're going to use the switch model. We're going to look at, the household income, and we know, depending on the household income, how much, people would be entitled to get if the affordable childcare scheme had been implemented in 2017. So again, we're going to give to every household who have children who are in childcare facilities, depending on the number of hours, and the level of income, we know exactly how much, people would be entitled to get in terms of subsidies, to put their children in childcare facilities. So here we're just reporting for a social risk. What's the mean weekly hours that people are putting their children in care? And we see the corresponding level of childcare subsidies. Looking at first the mean weekly hours, overall childcare for children, age, between 0 and 12, that's the average hours, being used in childcare is 22 hours. So it's slightly lower for lone parents and children. So as you can see that, it's almost, 20 hours. And looking at, the level subsidies, corresponding to the usage of childcare facilities. So it's much higher for lone parents, over 3,000 euros, and it's lower for other adults and children, 1,300 euros. And the reason being that, of course, is because the level of subsidies, that lone parents would get would be much higher, because, their level of household income would be much lower on average than it is for other households with children. So what's the impact, the effect of those subsidies on reduction on basic deprivation? So we can see that, the equivalent of the cash values of those being able to access the services reduce the level of deprivation to lone parents by almost 3 percentage points. So it's half that for people living in a household where someone has disability, and it's very low for, in fact, other household and children. And the reason being that, in fact, that for those households, they would get very little level of subsidies, compared to lone parents and children, for example. So finally, what is interesting is that, so far we only focus on people getting one scheme without looking at, if you can, being in receipt of a scheme here. So we're going to look at, the cumulative effect of those transfers that, people could get, maybe access to having medical card, but as well having housing transfers. So again, we're looking at, the number of schemes that people are in receipt across social risk groups. On the right side, we see that 44% of population are only getting one scheme, and very few are getting, 2 or plus of those 3 schemes. And if we're looking at people age over 65, 70% of them are only getting one scheme. And again, it's going to be either, the medical card or housing benefits. If we're looking at on the left side of the screen, lone parents and people with disability, we see that a very large proportion of them, in fact, are in receipt of 2 schemes, almost 50% for lone parents and 40% for adults with disability. And it's much lower for other adults and children, only 20% of them, are in receipt of 2 schemes. So what's the effect of cumulative effect of those schemes on reducing the level of deprivation? And here we're just going to look at, people who are in receipt of 2 at least of those schemes. So first, just before doing that, in fact, I'm just going to very briefly look at, what's the combination that people are getting, and across social risk. So we can see that, that when people are getting, some of those, see that, the most combinations, is really between housing transfers and medical cards, and over a third of lone parents and their children are in receipt of those 2 schemes. And it's the same proportion as well for people with living in a household where someone has the disability. And if we're looking at, those who having in receipt in only one scheme, we see that, it's quite common among, working age adults. Only 35% of them are in receipt only one kind of schemes, and it's 70% of older adults as well are in receipt in one scheme. Okay, so what's the effect of the combination of those schemes on the level of deprivation? So we see that, looking at, lone parents, the stronger effects is on lone parents, when people are receiving at least 2 of those schemes, so it reduced the basic deprivation by 3 percentage points, almost 3 percentage points as well for people living in a household where someone has disability, and it's very low for other household and very little for people age over 65. So mostly the effect is really very beneficial for lone parents and people living in a household where someone has disability. So just to conclude and to summarize, some of the findings and the policy implications that we saw through the previous slides. So we saw that social transfers and as well, benefits in kind, really have a role to play in social inclusion policy, because we saw that, across the individual schemes but as well overall, that they all contribute to reduce the level of deprivations. But again, by provide, services like childcare and health services that provide, services that, are really a part of today's life, and that, that if people do not have access to the services, it would be much more exposed to exclusions and would have as well over terrible consequences as well, such as people, having worse health outcomes. We saw that as well when we look at the access to those services or those transfers. There was very large variations as well across social risk. We didn't show it for social class, but again, we experienced, we had the same patterns across social risk and social class, where the most privileged groups, in a way, were less likely to receive those compared to the most vulnerable ones. So when we look at the groups, what kind of transfers people were getting, we found that that lone parents and people living in a household where someone has disability, we saw that that housing transfer were very important for those households. Childcare supports were very important for lone parents, and medical cards were obviously very important as well for people living in a household where someone has a disability. What we found is that the most the people who were most in need of those services, the most vulnerable groups, were the people that were the most deprived, and they were the most likely to get those benefits, and they benefit the most as well from those schemes. They are the one that really the level of deprivations was reduced, the most. However, and the minister has mentioned that as well, that we know that even after receipt of those schemes, we know that those groups are still experiencing very high level of deprivations, which means that as well that while access to the services and or those cash transfers are very important, there is other policy strategies that needs to be implemented again to continue and to contribute to reduce the level of deprivations and social exclusions which are being experienced by the most vulnerable in Ireland. Okay, so I think on that we're finishing our presentation, and I think we're very happy to get any questions you would have on these presentations. Thank you very much.
Okay, thanks so much for that, Bertrand. We have a bit of time for Q&A. So again, I'm going to invite people to submit questions through the questions and answer function. But I'm going to start off with a question myself, if I may. And I don't know, maybe you can take this, Bertrand, but I know Ivan might assist as well. But I noticed in one of the policy recommendations, I think this is actually in the report, there's a comment which essentially says that yes, we're finding good levels of targeting from these payments, okay, which is obviously very, very good news. But there's still a suggestion that some payments should be more broadly based, okay, which would seem to suggest that although targeting is doing its job, there's still a ways to go in terms of making sure that you capture enough vulnerable people under these payments. So I'm trying to get a sense, like, is the system working? Is it doing enough? Or are you saying, well, let's not worry so much about targeting and let's have these payments more generalized?
Do you want to take that, Bertrand?
Yeah. Yeah, that's the difficult question, Alan. Thanks for that. Yeah.
I mean, maybe there's no answer to it. I mean, maybe this is
Yeah.
just a dilemma in providing, and it's, it constantly comes up, issues of targeting versus universality. But just on the basis of the work that you presented, I suppose I'm curious if you have further views on the topic.
Yeah, it comes up in the literature a little bit. It's called the paradox of redistribution. I think it was Esping Anderson who kind of coined the phrase, and it does seem to come out that in countries with universal programs, they tend to produce better results in terms of reducing deprivation and poverty than means-tested ones. Now, they're not exactly sure, why that is. I suppose that's why it's called a paradox. So it's kind of a discussion, but it is a really kind of interesting finding. I mean, we're kind of touching on it here because the transfer tide to the transfer tide might be more beneficial than what exists in other countries. We just don't know. But yeah, it does seem to be that more universal programs tend to produce slightly better results.
Okay.
It's just to add on that, I think, that maybe just to add on that, what Ivan said, I think, maybe one of the issues that, maybe universal transfers have made the level of transfers that people would be able to get, might not necessarily, meet the needs, that when you target, vulnerable groups, that those individuals, would need, much more kind of a higher level of support that maybe what they would be able to get, through a universal system. So I think, we shouldn't, maybe drop or forget about, targeting groups, because here sometimes, we're dealing with groups which are really facing very high level of exclusions, because, they have, some characteristics that really puts them into very difficult situations. So I think, I think the targeting is still very important. I think, we shouldn't, forget about that.
Okay, listen, when I was introducing the Minister, my remarks earlier on, I went as far back and mentioned the Combat Poverty Agency, who were funders of this line of research many years ago. And it just so happens we actually have some questions from folks who go back to the Combat Poverty Agency. So I'm going to just take particular pleasure in relaying their questions. So a question from Helen Johnston. Local authority, as in social housing, may have a greater impact on reducing deprivation than the housing supplements and the benefits. So have we looked at all, maybe not in this study, but are any of the panel aware of the sort of the relative deprivation impacts of actually providing social housing as opposed to the supplements and the benefits?
Yeah. We don't look at that in this report. It is a really interesting question, because the people who are in social housing probably do have different rates of deprivation relative to the people that are not. But I haven't seen anything on the deprivation rates in social housing. What about you, Bertrand?
No, I think it's not something that we look at, but it's true that I think we could look at. We could, focus on people living in social housing and looking at their level of deprivation. But again, as the reason why they are in social housing as well, is that they are quite vulnerable groups. So we would expect anyway that they would have a high level of deprivation as well. But I don't think I've never heard about any studies anyway that looking at the impact of such accommodations and their level of deprivation.
Yeah, actually, it's interesting, but I suppose that always prompts the suggestion that maybe the study should be done, because I think it is a really interesting question about the relative impact of the different approaches. So thanks for that, Helen. So again, another old friend, Jim Walsh, asks a question, and you might have to speculate on it. So the first part of Jim's question is: were you able to look at all at the differential impact of the medical card and the GP only card? Okay, again, Jim is tight on, especially as the GP card now is being provided on a more universal basis. Okay, so the in a sense the two forms, the sort of Rolls-Royce medical card versus the GP only medical card. So any work looking at the differential impacts?
No, I think we just had the whole GP card and medical card all together. We did not split that. We something that could be done. Maybe I'm not sure. I think we would need to see as well about the size of the groups. When we split those, we might have some issue in terms of the cell size. But it's something, I don't know, it's something that maybe we could explore. But there might be some differences. It's difficult to know. I can't really speculate on that. But it's worth maybe just to have a brief look at that. Yeah.
And then Jim goes on to ask an even more difficult question, which I feel will come under the category of yet another interesting study to be done. But I'll ask is, any work done measuring the impact of the social transfers on health inequalities or child development? Okay, so clearly what this study is showing is the success of these programs in terms of alleviating deprivation. But I presume there is a body of work out there, even if you haven't done it, that looks then at the relationship between the reductions of deprivation and impacts on things like health inequalities. So has it been done in Ireland at all?
We have done some work on that in SILC, or not SILC, but using the Growing Up in Ireland data, looking at the impact of persistent poverty and deprivation on outcomes for children, not specifically health, but more socio-emotional development and cognitive outcomes. Okay. If the focus is on children, probably Growing Up in Ireland would give you a larger case base for that.
And what were the results, Dorothy?
Well, the results were quite interesting. They looked at using the first two waves of Growing Up in Ireland and the two cohorts, looking at the impact of being economically vulnerable in one wave or in two waves. And as you'd expect, families that were economically vulnerable in two waves, the outcomes for children were worse than if they had been vulnerable for just one wave. But what you also find that was quite interesting is that you have a negative impact for children of the family having been economically vulnerable 3 or 4 years before, even if their circumstances had improved in the interim. So you find evidence there both of the greater impact of persistent poverty and deprivation, but also of an impact that persists even when circumstances change. So that has consequences, I suppose, for policy choices that might be made that affect families.
Very good. Thanks so much for that. Well, look, we said we'd spent about an hour, and looking at my clock here, I see we have just coming up to the hour mark, so we might just call a halt now. So again, I know he's left the call, but I just wanted to say thank you to Minister O'Brien for coming along and addressing us today. Thanks to all the participants, and again, congratulations to the authors and the presenters for doing such a fine job today. So thanks again for everybody tuning in, and hopefully we'll be talking to you again very, very soon.